Thank you so much, Kim. Good morning, good afternoon, and good evening to everyone. I'm pleased to address you today for the official launch of the International Technology Transfer Centers Network. And I would like to start by thanking the National Rehabilitation Center in Abu Dhabi, who will be hosting an ITTC in the UAE, and for hosting today's event. I would also like to thank the International Consortium of Universities for Drug Demand Reduction and the ITTC Network Coordinating Office at the University of Missouri, Kansas City, and in particular, Lori Crum and her team, of course. I want to thank the Colombo Plan for their work to support the development of this new initiative, and acknowledge also our federal partner, the National Institute on Drug Abuse, and particularly my friend, Dr. Steve Gust. I also want to thank the keynote speaker, Dr. Jean Fixon, for sharing your work on implementation science. And I also want to recognize all of our country partner universities today from Vietnam, Ukraine, South Africa, the UAE, who will be the first to host the ITTCs. And we also look forward to having Peru join the network in the coming months. And thank you all for joining this webinar as well, and for your dedication in the field of substance use prevention, treatment, and recovery. Whether you are a practitioner, a government official, university professor, or just interested in learning more about this network, welcome to everyone. For those I have not met before, I work within the U.S. Department of State for International Narcotics and Law Enforcement, and focus specifically on counter-narcotics, including drug demand reduction. My office is very excited to be supporting the development of something new, these ITTCs, through the Colombo Plan. One of the benefits of this network will be a vast partnership, not only within the ITTC network, but also connecting to international partners and efforts, all focused on working to build the ecosystem necessary to address substance use. ITTC members will focus on analyzing the public health and criminal justice systems that support substance use prevention, treatment, and recovery efforts at a national level, paying careful attention to gaps, barriers, and other challenges in accessing services. Each national ITTC will be connected to other ITTC partners through ICU DDR, and will also connect to the US-based addiction, prevention, and mental health technology transfer center networks. As this network grows, it will represent a huge amount of support and access to data, tools, and research. There are many partners that will also be connected to the ITTCs, to include the United Nations Office on Drugs and Crime, the World Health Organization, the African Union, the Organization of American States, and the Colombo Plan. ITTCs can map treatment centers to identify workforce requirements before setting up action plans. ITTCs can also utilize UNODC's quality standards and key standards for treatment services and systems. Through the International Society of Substance Use Professionals, or ISUP, ITTCs can access training materials like the Universal Curriculum and other resources. In all countries with ITTCs, we should seek the establishment of ISUP national chapters, which bring together the prevention, treatment, and recovery workforce to promote evidence-based practices. As the ITTCs provide recommendations to government partners, they will find ISUP national chapters as a third key partner in engaging persons with substance use disorders or those at risk for drug use. Additionally, the ITTCs have a key partner with the Colombo Plan's Global Center for Credentialing and Certification, or GCCC. The ITTCs can facilitate the regular examination of the prevention, treatment, and recovery professionals. As I have mentioned, there are many reasons for joining the ITTC network. One, ITTCs can provide the development of a comprehensive drug prevention and treatment recovery system. Two, ITTCs can conduct assessments and epidemiological studies. Three, ITTCs can provide training, facilitate credentialing, and offer mentoring and technical assistance for the workforce. Four, ITTCs can implement quality assurance tools for treatment centers. And five, ITTCs can collaborate with ISUP national chapters to improve prevention and treatment programs. And I'd say this is just the beginning of the list. So in closing, I look forward to seeing more universities and countries join this new network over the coming years and sharing their tools, methodologies, and studies on common platforms for the benefit of all ITTC members. Having the ITTC network grow over the coming years will provide an increasing repository of resources and technologies that will help us achieve more efficient public health and criminal justice systems. It is my belief that these more efficient systems will more effectively support our target populations, leading to reductions in drug use and drug-related criminal behaviors. Thank you all for your support and participation in this endeavor.